Dave, thank you. Ann?
Great, thanks so much. I'm Ann Hwang. I run the Center for Consumer Engagement and Health Innovation. And our center works to increase the power of consumers, particularly consumers with complex health and social needs and their family members, to improve the healthcare system. And we do that by building out grassroots engagement with consumers who are served by these programs, by fostering policy change and providing direct training and support. In recent years, for example, in the context of the duals demonstration, we've worked in a number of states in advance of the demonstrations to go out, find consumers who are going to be impacted by these demos, engage them, activate them, educate them, and then turn them into a force for positive change in those demonstrations. And I also wear a different hat. I'm also a primary care clinician, and I work with dual eligibles, particularly those who are under the age of 65, which are sort of all grouped in one bucket in the taxonomy in Massachusetts. So from both of these roles, I've really learned the value that consumers bring to the table, whether it is helping to troubleshoot or improve a program, educating their fellow community members about a new program, serving in formal roles as ombudsmen or patient advocates, or providing peer support. So in reflecting on the report, I want to acknowledge the tremendous work that is represented by this report, the attention that Jeff, the Peterson Center, and the other organizations represented here today have done to highlight the need to improve care for complex needs. So as I read through the report, I had sort of 4 reflections. First, the healthcare system is failing the very people who need it most. As you read through the statistics about unmet needs for medical care and assistance with functional limitations and the challenges with care coordination, the words of one of the consumers we work with, a young woman who's dually eligible, ran through my head. She said of her experiences with the healthcare system, "It's a bad system filled with wonderful, well-meaning people." And I think she's exactly right. Caring for complex patients exposes all of the cracks and faults in our healthcare system, which we as individual providers really struggle to overcome. Our patient asks of patients or their family members to coordinate their own care, to ferry their medical records from place to place, and to serve as their own walking EHRs. And our system is one in which it is often faster and easier to just repeat a test than to even try to track down past results. The second thing I took away from this is that there is a silver lining, which may not sound like one, but it's that patients know when the system is failing. And again, that's borne out by a lot of the data that's presented. So that fact means that patients can help us identify when they're not getting effective care. And I think the taxonomy is a good start. What I love to see is all the brilliant minds work towards identifying a set of 2 or 3 screening questions, an index, of patients who are not getting the care that they need, probably some combination of the How's Your Health tool with a How's Your Care piece layered on, to help us identify where we really need to intervene. And that might be a way of getting to who needs intervention quicker than running through claims. So the third piece, and I know, Peter, you referred to this, is this issue of culture. And I think we need to imbue all of this work with an explicit patient-centered lens. And you mentioned this, that the organizational attributes of successful care models talk about leadership, customization, team relationships, training, continuous assessment, and data use. And I agree all of these are important. But I would say that these are generally strategies and not the vision or the goal of what we're trying to accomplish. And I think when you're working in a team and trying to carry out a complex task, a clear vision is the secret sauce that we need to change the healthcare system, so that we're no longer running around as providers thinking about completing a set of ever-growing and increasing number of tasks, but we're really oriented around how do we care for a person. And that means engaging that person and their caregivers so that we understand the whole person care that is needed to support that person's goals. So finally, I do also think we need to acknowledge the current political moment and what it means for this work. So just as we see such great progress towards improving care for those who are most at risk, frail elders, people with complex conditions, and people who face social as well as health challenges, there are tremendous changes that are being proposed to healthcare coverage in this country that could threaten the care for exactly these populations. So our center is working directly with consumers, including older adults and state-based consumer advocates, to empower and equip them to speak up in support of the policies and programs that they need for their health and well-being. And similarly, I think, Peter, you talked about supply side. The supply side is interested towards moving these models, but I think it's also important to think about creating demand. And how can we activate consumers to demand the care that they need and think of them as partners in this work? So I'm daunted by the challenges ahead, but I definitely take strength from the collective wisdom of patients and their caregivers, who truly are the experts in their own conditions, and the wonderful collection of colleagues and experts that are assembled here and hopefully listening as well. So we have much to accomplish together, and I really look forward to hearing from those in the audience and also my fellow panelists.
And thank you very much.